This is very quick, yung law. Okay, so so far, actually I'm a close contact of a colleague. Tapos magkasama kami Tuesday. Doon siya umupo sa table ko, katabi kami, doon din siya kumain. Tapos that was Tuesday. Thursday niya positive, pero meron na siya nararamdaman ng Tuesday. Positive yung father niya Thursday, nag-positive siya ng Friday, namatay yung father niya ng Saturday. And the father infect 5 more. Kaya it's very talaga kakapraning. Anyway, kamusta kayo? Sorry I was very kagabi, kahapon parang siguro napapraning lang talaga ako. So anyway, the law on HIV is Republic Act 8504. Tatandaan niyo yan 8504 hanggang maka-board exam kayo, kasama yan sa board exam. Okay? So RA 8504 is about the Philippine AIDS Prevention and Control of Act of 1988. Okay. So, very quickly, it was enacted last February 13 of 1998. And the IRR was promulgated on April 13, 1999. Importante na may IRR kasi without the IRR, the law will not be implemented. So, this is an act promulgating policies and prescribing measures for the prevention and control of HIV/AIDS in the Philippines. Siguro after yung gustong magpa-test, maybe after the siguro finals na or you are all welcome to have a test. So this is the RA 8504 institute a nationwide HIV/AIDS information and educational program, no? And also it established a comprehensive HIV/AIDS monitoring system. It strengthened the PNAC, or the Philippine National AIDS Council, and for other purposes. And the declaration of policies that the gravity of AIDS threat demands state action today. It always meaning parang sinasabi dito na kailangan mag-act na talaga yung gobyerno. It demands the state to act today, no? Ito no sinulat ito wala LGBT pa lang. Ngayon meron ng LGBTQI, no? May I na, di ba? And the state shall promote public awareness about the causes, modes of transmission, consequences, means of prevention, and control of HIV/AIDS. And the state shall extend to every person suspected or known to be infected with HIV/AIDS full protection of his or her human rights and civil liberties. So meaning, even if you are positive with HIV, you can still report to work, no? And also, you can still be a doctor even if you are HIV positive. I think we have about 3 students that are positive with HIV. And they are now a full-fledged doctor. So toward this end, compulsory HIV test lawful, no? Unless otherwise provided in this act. So up to now, there is no compulsory HIV testing. It is still voluntary, no? And then the right of privacy of individuals with HIV shall be guaranteed. And then discrimination in all its forms and subtleties against individuals with HIV or person perceived or suspected of having HIV shall be considered inimical to individual and national interests. And provision of basic health and social services for individuals with HIV shall be assured. So Article 1 is about education and information. Section 4 is HIV/AIDS education in school. That's why we are doing it. Meron kaming life at the crossroads among high schoolers. And then not only to students but also to teachers. So we are training teachers for life at the crossroads. And then section 5 is HIV/AIDS information as a health service. So through the health workers and its clients. And then HIV/AIDS education in the workplace, employers and their employees. So it's already mandatory that all establishments with, I think, more than 15 had to have an HIV/AIDS education. And then Section 7 is HIV/AIDS for Filipinos going abroad. And the OFWs, diplomatic, military, trade, and labor officials to be assigned abroad. Article 11 is about safe and practices and procedures. Section 12, requirement on the donation of blood, tissue, or organ. No laboratory or institution shall accept a donation of tissue or organ unless a sample from the donor tested negative for HIV, and all blood shall be subjected to HIV testing. Pero yung mga mass blood donation, hindi muna nila tinetest. Mag-aano muna yan sila, magkukasya muna, yung iba, kukuhanan ng dugo, tapos after pagdating sa tsaka nila tinetest for HIV. On surgical and similar procedures, universal precaution must be observed. And then penalties for unsafe practices and procedures, penalty of imprisonment for 6 years to 12 years, fine, suspension, or revocation of license and permit of any licensed business entity and the accreditation. Article 111, tandaan nyo yan testing, screening, and counseling. Under that is the pre-test and post-test counseling. All testing centers, clinics, or laboratory which perform HIV tests shall be required to provide and conduct a free pre-test and post-test counseling for a persons who avail of their HIV/AIDS testing services. Nagpunta kami noon sa Anibong High School, yung night high school. So far wala namang nag-positive, no? Nagpa-examine talaga yung mga bata. And then, Section 21 is support for HIV testing center. DOH shall build and enhance the capabilities for HIV testing of hospitals, clinics, laboratories, and other testing centers, primarily by ensuring the training of competent personnel who will provide such services in said testing sites. Article 6 is about confidentiality. Section 30 is medical confidentiality. All health professionals, medical instructors, workers, employers, recruitment agencies, insurance companies, data encoders, and other custodians of medical record, file data, or results are directed to strictly observe confidentiality in handling of all medical information, particularly the identity and status of persons with HIV. Penalties for violation of confidentiality. Any violation of medical confidentiality as provided in Section 30 and 32 of this Act shall suffer the penalty of imprisonment for 6 months to 4 years, revocation of the violator's license to practice, as well as cancellation or withdrawal of the license to operate any business entity and the accreditation of hospitals, laboratories, and clinics. Kaya itong mga HIV positive, mga naka-code lang sila. Any person with HIV is obliged to disclose his or her status and health condition to his spouse or sexual partner at the earliest opportune time. So, i-encourage namin yung HIV positive kung meron siyang partner to disclose his or her HIV status. Article 7, discriminatory acts and policies. Discrimination in the workplace, discrimination in schools, restriction on travel and habitation, inhibition from public services, exclusion from credit and insurance services, discrimination in hospitals and health institutions, denial of burial services. And penalties for discriminatory acts and policies, imprisonment for 6 months to 4 years, and fine not exceeding 10,000, licenses and permits if found guilty shall be revoked. So pag halimbawa, meron dyan sa inyo, sa barangay nyo na may HIV, hindi pwedeng wag nyo silang papatirahin dyan. Ha? Pwede rin sila. Pwede silang mag-aral, pwede silang magtrabaho, pwede silang magbiyahe. And should not be discriminated. So for focus areas, prevention is value-based life skills, parental guidance, voluntary counseling and testing, marriage enrichment. For the care, people living with HIV and AIDS, orphans and vulnerable children, home-based care, nutrition. For the support, creative supportive environment, pastoral counseling if needed, support groups, and psychosocial support. So for the skills building, empowerment of the youth and the mothers, access to resources, community mobilization, and training of facilitators. So lahat yung ginagawa namin. So advocacy, access to treatment for antiretroviral, post-exposure, prevention of mother to child, position of women and children, reduction of stigma and discrimination of people living with HIV/AIDS, church community capacity to respond to HIV/AIDS, organize World Day event or AIDS Candlelight Memorial, and organize blood drive, blood donation cards to be given to HIV patients. Kasi they die not of HIV, but they die of immunocompromise. Question so far? Sa HIV? Meron kayong question before we move to vaccination? Yung magpapa-immunize, yung magpapa-test ng mga nag-text, after the exam na lang. Kasi medyo toxic ngayon dahil sa renewal of licensing. Okay? So, let's move to principles of vaccination.